Welcome to another episode of the Balancing Hormones Naturally podcast, where we offer actions and steps you can take today to start balancing your hormones naturally. This is your podcast host, Leah Brueggemann. I am a functional diagnostic nutritional practitioner. I am honored and excited to be your guide on your journey to better understanding your hormonal health and how it affects your everyday life. Hey ladies, welcome back to another episode of the Balancing Hormones Naturally podcast. I think you win the award, Angie. I think you've been on the most. This is your third time. So you would be our most popular guest.
I'm honored.
But it just covers so many aspects. We have to talk about pelvic floor. So I did Killian's birth story, who's baby number 2. And I talked in there about my labor a little bit. And I was saying that I noticed such a difference between baby number 1 and baby number 2 in terms of my labor and my recovery with just everything. We'll get into it more. And I got so many messages of people who are like, so what did you do? Because I went to my pelvic floor therapist during pregnancy and they just, had me do Kegels, or they had me do they told me to get into a squat when I wanted to give birth, or they just told me to, do Kegels while I was doing lunges and all sorts of weird things. I'm like, well, I didn't do any Kegels. I hate those.
Yeah.
So I wanted to do kind of a recap. So I wanted to share a little bit about the differences between my 2 labors. And I would love if you can kind of come in with the science of why that was the way it was. And then we can talk about what I specifically did during my pregnancy for such an awesome labor.
Yeah. Excellent. Yeah, I'd love to dive into that.
Okay. So some things I feel just were completely out of my control. With baby number 1, I had an episiotomy, you look back 2020 vision,
Sure.
Would have not chosen to have that. And I didn't with Killian. So I know that probably played part of a role in it, but with, Landon, I feel the typical things people tell you to do, get into a squat while you're in labor, do lunges, do all those things. And during that pregnancy, I had done the typical pelvic floor therapy route. I had done some core guides, where it was, not bad advice, but it was, a lot of things where engage your TA. I don't even know what that stands for. I just know that's what they call it.
Right. Yeah. Transverse abdominis. So you're describing the typical kind of standard of care textbook PT. And there are positive things to doing those exercises. However, they don't address everything that truly needs to be addressed. They're just they're very superficial and often don't result in true, big changes. So,
that's what I definitely, because I feel I got halfway through my pregnancy and I was still lifting pretty heavy. And I started to, every time I sneezed, I would having leaking. And I was just okay, maybe that's because baby is sitting on my bladder or something. I just kept writing it off as it's pregnancy.
Yeah, let's talk about that real quick. That's specifically because that's an important topic. And so many women think oh, I'm pregnant and I'm leaking, so this is part of pregnancy. It's a normal thing. Go on with life.
Right.
If you are leaking, that is an indication that your pelvic floor is in an extremely vulnerable position and is getting injured. So something needs to change. So if you're experiencing continence, you do need to take a really deep dive into your daily posture and breathing mechanics, your lifting techniques, how much you're lifting. And then you also need to look at how much, like, what is your exercise and what's your daily activity like? So you might need to take a step back during pregnancy, which is difficult for active, busy moms a lot of times.
Yeah. And
So.
he was my first kid too. So it wasn't like I had anything to kind of compare it to. I was just like, you hear stories. This is pregnancy. Like, it is what it is. And I even, now that I know the difference, like back then when I was lifting too, I would definitely do the breathe into your belly before, you do the squat, which now I know that like is putting my pelvic floor in a weakened state. Yeah. So I just unknowingly, I was doing like everything wrong, but it's so tricky because when I learned better and I would do any type of like YouTube workout, I would have to reverse everything they said about breathing when I would do an exercise, because that's just like a thing that seems to be in prenatal videos, which again, none of these instructors are even pelvic floor therapists. Some of them are, but they're always like, breathe into your stomach and then breathe out as you do your squat. And I'm like, well, I know that's not a good idea to do. So, could we talk about that really quick, just in terms of like working out?
Absolutely. Yeah. That's another really important point. So, whether the information is coming from a prenatal exercise instructor or a pelvic floor physical therapist, it still should be questioned, because pelvic floor therapists actually say that too, who are not necessarily trained in the most up-to-date methods. So when you are, well, let me just defend this position a little bit because it does have some truth to it. The reason they tell you to breathe into your belly is to relax your pelvic floor, and their idea is to get it to a point where, go all the way down and then re-engage during the exercise. So they're thinking of more along the lines of like the voluntary activation of your pelvic floor muscles. Unfortunately, this doesn't necessarily work because your pelvic floor muscles are primarily involuntary. And so the best way to activate them to support your uterus during pregnancy and really to support your body during an exercise is to elicit a reflex that triggers their activation. Number 2 point that's very important, besides triggering a reflex for pelvic floor activation, is that the best pelvic floor activation occurs when the pelvic floor muscle is unloaded. Okay, so that means it's the organs above it, uterus, bowel, bladder, are lifted up. When the pelvic floor has like a little extra space, its reflexive activation is going to be so much better because all the nerve flow and blood flow, it will literally have more room to receive the nerve inputs and the blood flow it needs for a full range of motion contraction. So during exercise, during pregnancy, and this is true postpartum too. This is true prepartum. I talk about this to elite male athletes. So it's not even like just a female pregnancy thing, but it is extremely important in female pregnancy because that's when our bodies are the most vulnerable to injury, and then also in the postpartum phase. So breathing with exercise during pregnancy, you want to direct your inhales into your rib cage and not your belly. And a lot of times when I talk about rib breathing, I get some pushback from people saying, no, that's shallow breathing. Like, no, that would elicit hyperventilation. And there's a lot of pushback because belly breathing is so trendy and cued so often. It's like overused, and it's overused by people who don't understand the mechanics and relationship between the diaphragm and the pelvic floor, and people who don't understand the pressure system of the core. So when you breathe into your belly, your diaphragm moves down. Your diaphragm will then moving down because air is coming into your rib cage. Diaphragm moves down. All of your organs move down as well and pressurize your pelvic floor. So now, if you're trying to do a voluntary contraction after a belly breath, you're going against a lot of resistance, and you're only activating the voluntary muscle fibers, which is 20% of that whole muscle. So what that leads to is increased pressure in the abdomen and the pelvis and the spine. Increased pressure, compression, which you're already getting in like extensive increasing amounts in pregnancy. And then in addition to that, because of the increased pressure, you're loading the fascia instead of the muscle. And the muscle is actually more prone to getting into a spasm, which means it gets locked in a contraction. And then the load continues to just be absorbed by the fascia instead of the muscle. So that's what happens when you belly breathe during exercise during pregnancy. If you bring your inhales into your rib cage, and when I mean that, I don't mean, the shoulder breathing, the breathing into the upper lungs. Actually, breathing into your lower ribs first, and then filling the rib cage from the bottom to the top, and filling it in like a 3-dimensional 360 fashion, lateral and front to back, from bottom to top, results in a lifting and opening of the diaphragm, a big expansion of the rib cage. When those two things happen, the pelvic organs lift, because it's all connected through fascia. So if like the diaphragm lifts and opens, that because all the pelvic organs are connected to that fascia, they're going to lift off the pelvic floor during that inhale, and the pressure will decrease. And then you exhale as you elongate your spine or grow through the crown of the head to get a further pressure release, and then a involuntary pelvic floor muscle activation, which typically occurs on the exhale.
And this is where I think people are like, oh, I do like 100 Kegels a day and it never worked. And that's because they're probably getting locked in that pelvic spasm, and it's like trying to tighten it voluntarily isn't fixing it, right?
Exactly. So Kegels are isolating one piece of the whole picture. If you isolate any part of the body, you're not going to get like a functional response in rehab. And in no part of our life do we only use one single muscle. We use our muscles in conjunction. So you have to train the pelvic floor with other muscles simultaneously. And 99% of people with pelvic floor dysfunction symptoms have pelvic floor muscle spasm, which means that pelvic floor is locked in a contraction. It's stuck in a Kegel. And so we need to unkegel it in order to get it to move through its full range of motion again. So oftentimes Kegels are not helpful. And as you know, I don't even teach clients to do them unless, the situation calls for it, which would be like indications of like a very lax pelvic floor, which is actually extremely rare. And the cool thing is because the pelvic floor is primarily involuntary muscle fibers, if you just unload it and trigger reflexes, you're going to get a complete rehabilitation and full strengthening of the pelvic floor without even thinking about it. It will just happen automatically.
Yeah, I never did a plank or a crunch or a Kegel. I didn't do any of those things. So I don't know if this just could be my personal theory, but because I didn't do any of this during my first pregnancy, and I got, I don't know, probably to my third trimester, and I was having leaking issues when I would sneeze or when I would do certain exercises. And I remember I like just reached the stage where I would stand up and I just like felt like someone punched me in my pubic bone. Like I just had to like stand and breathe. I was like, I cannot even walk. It would take like at least 30 seconds and then like hobble, and then I would be able to walk. And that was happening like way too often. And thankfully, Seb had given me some like glute exercises that made it bearable at that point, but not anything that fixed it. And so in my personal theory brain, I'm like, okay, so I wonder if like I was stuck in that spasm and I wasn't able to relax enough, like I didn't have enough cushion. And I wonder if that probably could have led me towards having to get an episiotomy opposed to like baby 2. I did have like that control and able to relax the pelvic floor, so I didn't have an episiotomy. I don't know. What do you think?
Yes, I absolutely agree with that theory. Absolutely. In your specific case, I get a little nervous about making like huge generalizations because we know that every labor is so different, and position of the baby comes into play, the environment the mom is in, how relaxed she is, like other factors of stress, or there's so many things that comes into play that leads to the pelvic floor muscles not being able to relax, and then tearing or episiotomy, is the intervention that's necessary. It can also just simply be like you have a really big baby and you have a smaller pelvic floor. Like, so it's not like a broad generalization. We have to like keep in mind this is like a complex situation we're looking at with so many different factors. But yeah, I agree with you in your particular case, the fact that during your first pregnancy, you didn't have a tool to relieve the chronic increasing pressure on your pelvic floor over the course of 10 months. And so it got really, really tight.
Yeah.
And then during labor and delivery, that muscle just didn't have its range of motion, and it was unable to relax. And then second pregnancy and delivery, you were very regular and super consistent with your exercises that unloaded your pelvic floor and lifted your uterus. And you were also simultaneously doing belly breathing and relaxation exercises as well. And I'll just make an important note about this belly breathing. Belly breathing is extremely important in pregnancy. You just don't do it while you exercise. Okay. So you lay down on your side and you belly breathe on your side. And then as you get into, mid to late third trimester, then you start belly breathing against gravity in like a sitting position or a standing position or a squatting position to prepare to bring baby down and prepare for delivery. But to belly breathe during exercise is going against the mechanics, the muscle biomechanics we want to occur during exercise. So so the combination of doing active unloading of the pelvic floor and reflexive activation through exercise, coupled with separate lay down on your side and really relax your whole body and focus on relaxing your pelvic floor, like absolutely set you up for an incredible smooth delivery with no complications for your pelvic floor, which is like so amazing. And a lot of women who've had an episiotomy first, first delivery typically have another, maybe a tear, or like need another intervention on their second delivery because that scar tissue isn't quite as strong. So the fact that like you even overcame that is really exciting, and just a testament to how consistent you were with your your self-care and your exercises.
Yeah. I even thought like my first labor, I thought it wasn't bad, and it wasn't. Like for a first labor, like I had a great first labor. And I didn't think that he took super long to come, but then when I had my second labor, I was just like, whoa. So different. And I didn't even think number one was bad. But just the most massive difference ever. Like, I mean, heading into this, the second one, I was emotionally ready to have the baby. I was like, I am so done. But I was still, I was walking. Like the day I had him, that morning, I walked over 2 miles.
That's awesome.
And I'd been doing that whole week. I didn't have, any pain in my pelvic floor, anything like that. And I remember telling you it was really hard. Like halfway through my pregnancy, I had to stop like lifting heavy, but that just, like, you're like, it's okay. And it was so hard. I'm like, I don't want to lose all my muscles, but I could tell I was losing control over my pelvic floor because we had only been working together, I think maybe 4 weeks before I got pregnant. So I didn't have, a ton of time to like get really, really strong before I got pregnant. So I'm hoping, maybe in the future I could continue longer, but I had to like get off my ego, and I went to really, really just like 5-10 pounds or even like body weight and walking. And I just did my breathing exercises. And, I did the glute workouts from your program.
Yes.
Which were amazing because if I'm doing anything that's not weightlifting, I like to watch a video and I like to hear the correct cues.
Right.
And I was telling you, I was so frustrated because every time I did a workout video on YouTube, they were giving incorrect cues. And so then I'm like, this is dumb. I have to mute you anyway because I want to make sure I'm breathing correctly.
Right.
So I would do those 3 times per week. So I did 3 per week, and then I would do my breathing exercises.
Yeah.
And like I said, I was walking right up to my labor. I didn't have any pubic bone pain, like nothing like feeling like I was getting punched in the gut or anything like that. And then, when we got to the hospital, and by the time it was so short, it was just so short, and I was just doing my exercises that I knew I was supposed to do to help bring baby down, which I think was huge because by the time I was 10 centimeters, he was there. Like literally I went from 8 to baby being out in like 5 minutes because by the time I was 10 centimeters, he was down and ready. Thank heavens for like all of that breathing and core work to get him down there, which was awesome.
Yes. So, a couple things on that. Just thinking of like the science, like what was happening at the muscular level during your experience leading up to delivery, and being able to like walk 2 miles and not having pubic bone pain and all of that. So I'm thinking of, your rib cage muscles, your intercostal muscles, your diaphragm, your abdominal muscles, your spinal muscles, and your pelvic floor. Those muscles, those important core muscles, were all synced up. And with every inhale and exhale you took throughout your day, they would depressurize your pelvic floor and lift your uterus a little bit. So that became like automatic for you. And that's why you didn't have pubic bone pain. And then you listened to your body when it was giving you signs that it was getting too pressurized and it didn't have the strength to unpressurize you. And so then you took a step back, you modified a little bit, and you continued with the protocol. And so that set you up with a core system that worked in a way that would reflexively, without you having to think about it, lift your growing uterus off of your pelvic floor with each inhale and each exhale. Then another interesting thing to just kind of note is uterine contractions, right? The uterus is a muscle, as we know, that, and the uterus is a muscle that is 100% involuntary muscle fibers, just like our heart is, involuntary muscle fibers. So uterine contractions are coupled with the lifting of the uterus. So hypopressive training, which we did during your pregnancy, when you do that training, your uterus lifts, and strengthening the lifting action of the uterus also strengthens her contraction action.
Oh, okay.
And so now you're going into labor with a stronger uterus muscle.
That makes sense.
The other thing that made your uterus as a muscle stronger is the position of her.
Oh, yeah.
So, if you go into pregnancy with a uterus that is tilted to the left, and maybe this is associated with left SI joint and left hip pain, or you maybe have your left knee and ankle, or it's so many manifestations. Then, and you don't really do much for that, then she's going to stay over on that left side your whole pregnancy and your delivery.
Yeah.
And then if she's kind of tilted a little bit and compressed, her contractions won't be as strong during delivery.
Yeah.
And so
okay.
if you're implementing a practice throughout your pregnancy that is centering to your uterus and lifting, you're strengthening her contractions for delivery. And then simultaneously, you're training your ability to relax your pelvic floor and open. And so that coupled with allowing your uterus to do all the work is the key. A lot of people ask me, like, how do I breathe during labor? Or like, how do I push? And I think that there's a misconception that there's this like kind of maybe complex, magical way to like breathe and contract your abs so that like during delivery, right? Like, I think there's a little bit of a misconception there. And I just want to clear that up, that it's like actually so simple. It's actually so simple. All you have to do is implement the protocol that you did, Leah, through your pregnancy, which is just getting your pelvic floor and your core to reflexively function how it should and lift your uterus. Then simultaneously practice relaxing your pelvic floor. When it's game time and you're in labor, all you got to do is belly breathe and relax and let the uterus do her thing, and just relax as much as you can. I mean, I'm saying this is simple. It's not like simple when you're doing it, but it's not this complex thing that like you have to remember this like, specific breath pattern and this like certain way to contract.
No.
All you're really doing is relaxing your body so that your uterus can be fully oxygenated and there's no energy going to any other muscle in your body, so that your uterus gets all of the energy, and then you're just surrendering into that and belly breathing and letting your body take over.
Yeah. So there was one part I remember where I was like, okay, I'm having SI joint pain and it's not staying in, even if I would get it popped in. And that's when you were like, oh, you had me do some exercise to help balance something. Something
Okay.
with, was it my glutes? I don't even remember. I just remember every morning I had to do like 5 sets of this like stepping kick thing. But like, I mean, no more SI joint pain. Because
Yeah.
we were talking about it, we were thinking he was sitting on one part of my hip, like I was slightly tilted. So we just kind of like moved him back over,
Right. Yeah. So
which was
that
really
work was
helpful.
focused. That was like focused glute work. And what we needed to do was fire up your gluteus medius muscle, which are the lateral glutes on the side of your hips that stabilize your pelvis. And often those get weakened due to overuse. Actually, during the
Mhm.
end stages of pregnancy, those muscles can develop a lot of trigger points in them, which then kind
Mhm.
of like weakens them. And yeah, especially even if, you're doing your hypos and your uterus is like, you're constantly trying to center her. I mean, at that end point, if the baby is like, I like my head over here and my feet up here, it's just, you're going to have a little bit of this like torque going on. So
Yeah.
incorporating that specific glute training is really important. And that's that lateral glute work, which you can get through like the sideways leg kicks
Mhm.
and kind of like specific like marching exercises combined with
Yeah.
squatting and some lunges can be helpful for correcting the SI joint problems. Yeah.
Yeah. Yeah.
We're going to take a quick moment for today's sponsor. Seed cycling is such an easy hack to support the rise and fall of your hormones, and let me tell you why. They are rich in zinc, selenium, magnesium, vitamin E, soluble fiber, omega-3, and lignans. These are all necessary nutrients that your hormones need to function optimally. Now, obviously, please don't eat these seeds if you're allergic to them. But if you aren't allergic to them, seed cycling can be such an easy hack and part of your puzzle piece to add to your life to help support your hormone balance journey. You want to give it a minimum of 3 cycles in order to see a difference, because remember, you have that 90-day follicle journey. So from the start of that follicle to when it releases the egg is 90 days. So what you're doing right now is going to directly impact your period 3 months from now, right? Or 3 cycles from now. So you do want to stay consistent, but I bet if you add this in to all the other amazing things that you're already doing, you are going to really, really love it. So remember, seed cycling is 1 tablespoon of pumpkin and flax seeds from your period to ovulation every single day, whole organic seeds, and then grind them before eating them because you don't want them to go rancid. And then from ovulation to period, you're going to do 1 tablespoon of sesame and 1 tablespoon of sunflower every single day. Remember, buy whole organic and then grind before eating. If you have no cycle, cycle with the moon, you guys. So the new moon, start your pumpkin and flax seeds, and then the full moon, start your sesame and sunflower seeds. Now, you guys, I use Funk It Wellness seed cycling subscription because I don't run out of my seeds, and they also taste better than the ones at the store. So Funk It Wellness uses B Corp organic certified seeds, and they are ground right before they send them to you, and they're in dark colored bags so light doesn't get through, so they won't go rancid, because ground seeds can go rancid pretty fast. So that's why you don't want to buy them ground at the store. They're ground right before they're sent to you, so you don't have to worry about them going rancid. They taste amazing, and you guys, not having to grind your seeds every single day has been the most life-changing thing for me being consistent with my seed cycling. So go to Funk It Wellness. You guys do the subscription. You can cancel if you don't want to stick with it, but like do the subscription because you get free shipping. Who doesn't want free shipping? And you'll get a discount. And then use the code LEAH15. You get an extra discount, making seed cycling extremely affordable.
And I know some women like have the labor that I just described for their babies, and they're like, I didn't do anything. But I know specifically that the core work that I did was the difference, because I have had a different pregnancy and labor. Like, you would think like your first pregnancy would be the best pregnancy in terms of like physical strength, but mine was not. Like, it was definitely my second one. And I mean, my husband will even attest to this. So after my first baby, I had been awake for 40 hours by the time I had him. So I was just wiped, like physically wiped. But my whole body felt like it had ran 25,000 marathons. Like, my neck muscles hurt, my shoulders hurt, everything hurt. And every time I stood up, I felt like you would involuntarily put your hand to your stomach because you're like, I think my organs are going to fall out. You know, you just feel like everything is floating very weird. I couldn't sit up by myself. Like, I couldn't even pull myself up. Like, Seb would have to help me. And this, I think, could have been just really long labor. The labor wasn't that long. It was just the timing of when I went into labor. I was up for so long. And then I remember they would do the classic, like, okay, here comes your contraction, push, and all of that. And I didn't push very long. It was under 10, 15 minutes, I think. So still not a bad first labor, but like, I felt like I had been through battle, which you kind of have. And that whole week, Seb had to help me sit up. Like, every time I had to sit up and I was holding the baby, like, I couldn't do it. Like, it wasn't just like, oh, this is so hard. It was like physically incapable of sitting up.
Yeah.
And when I started working out, which was probably 8, 10, 12 weeks, it was very far after, because it took forever for me to stop bleeding and not feel so sore and swollen. I mean, if I did any exercise, you could probably blow on me and I would have fallen over. I was just like, I have no strength. And it was just so disheartening.
Yeah.
And second baby, I didn't push, like, mentally. It was just like, I was just like, okay, he's coming. And they're like, no, he's not. Because they had just checked me and I'd been 8 centimeters. And I was like, no, he's coming. My body is pushing. And they checked. They're like, oh my gosh, he is coming. Get the doctor in here. And Seb says that he remembers the doctor telling me one time to push, but like, I never voluntarily pushed. My body was just like, we know what we are doing. And I, like, shorter labor, but what hurt afterwards was like, obviously you just pushed a baby out, so that hurt. But like, the rest of my body was fine. Like, I didn't feel like I had, run marathons. Like, my neck muscles and my jaw and my arms, and like, none of that was sore, which was very nice. I stood up and I was like fully ready for this feeling. I was like, it's going to happen. It's the worst feeling when you feel like your organs are going to fall out of you. And I was like, oh my gosh, I can walk. My organs are fine. They're all where they're supposed to be. So that was amazing. And literally, I mean, I could hold Killian just fine. I didn't feel like I wasn't going to be able to support him. I could sit up. Obviously, I did so safely and everything, but I could sit up just fine. I stopped bleeding way sooner with Killian. And then I started doing my breathing exercises literally the day after I had him. I was just doing them laying down. I would do some to help center everything. And I started doing gentle workouts. And I think so how old's Killian? We're at 4 months. So Killian's 4 months. And that's about when I started working out with Landon. So like, just wild. I've been working out for 2 months. And like, my strength is like here, like I'm doing all of my like squats, bench, all of that with no issues with my pelvic floor whatsoever. And the biggest just like mind-blowing thing, so this is completely cosmetic, guys, but like, baby number 2, everyone's like, oh, it's like harder to go back after baby number 2 or baby number 3. I don't know. But baby number 2, Killian, my waistline at like, 4 weeks postpartum, I think, looked better than it did with Landon at 12 weeks postpartum. I have pictures. Like, I'm not going to share those to the internet, but like, I literally have like see the difference, which is mind blowing to me. Like second baby, exciting. But my weight is smaller. It was awesome, but yeah.
Our bodies are incredible. And all they need it's the right input. That's all it's just if we give our bodies the right input and put function first. This is key. Function first. The aesthetics are a really awesome bonus. The aesthetics actually follow function. But you have to approach it from function first and then aesthetics. I think that is kind of a limiting factor of a lot of postpartum workout programs and mindsets and cultural mindset is like we approach it from like, I want to get, I want to shrink my waistline ASAP. And when you think about it in this kind of like, I don't know, like aggressive, limited, restricting way and not like a nurturing, caring, like let's like do function first. You don't get the results. So, but the fact that you had those results tells me that your core was functioning properly, like so much quicker. And it also tells me that like we really accessed it's called the autonomic nervous system, the involuntary side of the nervous system, which is what controls 80% of your core muscles. So we successfully did that through the breath practice. And that's also what led you to be able to relax all your muscles during labor. So you being so incredibly sore your first labor, like whole body, like you were run over by a truck, you couldn't stand, you couldn't hold your baby, like every muscle was maximally contracted repeatedly for 40 hours, and your body was taking up all the energy, like your uterus is part of your body, but like the rest of your body besides your uterus was taking up all of your energy. And so your uterus had less energy and less oxygen to do her thing. Labor lasted longer. You got super sore. It was like you were fighting yourself, but you didn't know how to not. So then during your second pregnancy, we used like breath training is like everything. That's like our primary thing we do. And when the specific breath patterns we use in hypopressive training, where you inhale through your nose into your lower rib cage to expand it, that's calming to the nervous system. And then when you exhale twice as long, 3 times as long, 4 times as long as you inhale, staying in exhale lowers your heart rate, lowers your blood pressure, puts you into this like calm state. And just doing that breath training will result in you being able to relax under a stressful condition, whether that stress is mental, emotional, or physical. It will transfer. So
yeah, that makes sense. And it's just wild to me because like I didn't even think I had a bad first labor. Like I didn't. I mean, I was up for so long because he decided to go into labor at 11:30 p.m. So like I had already been up for the entire day. And then I didn't have him till 2 in the afternoon the next day. Killian decided to do the same thing. I went into labor at nighttime, so I had been up all day, but I had him at 6:45 that morning instead of like being in labor for like an extra, I don't know, 8 hours.
Right.
So it's just, I mean, I just want everybody to experience that, because after Landon, it wasn't even a bad labor. It was a good labor. Nothing traumatic happened. You know, baby, mom, everybody was healthy, and I loved my labor and delivery team. But I was just like, oh my goodness, that was so hard. It was so hard.
Yeah.
And I'm like, I am terrified to do that again. Labor is really hard. I'm still terrified to do it again, but I felt more optimistic and so much more hopeful, because I was like, wow, that was so much better. It was so much better.
Yeah.
And that was just preparing 4 weeks before this pregnancy and all through my next pregnancy. And so now I'm like, dang, I got these tools for my life now, which is incredible.
Yes. Yeah, absolutely. That's huge. And you know, another thing that, you know, makes me think about it's mindset too. And it's challenging to have a positive mindset going into your second delivery if your first one was really difficult. Mm-hmm. So, even more important to have these tools to improve, you know, your confidence going into it. And even if it's not like a lot of like mental training or anything, if your body is physically, you know, stronger in the right ways, and you've been consistent about that, like self-care and that protocol throughout your pregnancy, that's going to help your mindset. That's going to help your perception, like going into it, which is a giant factor of the outcome. Like our perception of what it's going to be like is huge when it comes to like your actual experience.
Yeah. Which, I mean, I know standard care. I remember asking my OB from Landon's, like, oh, you know, should I get pelvic floor therapy? Just asking at my 6-week checkup. And they're like, well, do you have any issues? Like, otherwise just come back in 6 months and we'll see what's going on. And I'm like, okay. But with Killian, it was like all through my pregnancy. And as soon as I had him, because I knew better. And I think that's why I want to spread this, because I'm like, you guys, it was just a life-changing, different postpartum experience. Like, I wish I could gift that to everybody. When you feel, you know, like you're just not going to fall over. You don't feel so weak. Like, I mean, it's so, so nice.
Yeah, absolutely. And I agree. Like, thank you for spreading this word. I want to share that too. It's so important, because standard of care, Western medicine currently is not caught up to this possibility, and does not, I mean, really our medical system as a whole does not allow for any emphasis in preventative medicine, holistic medicine. They don't look at the mind-body connection, and it's like, it's so limited. So they only treat you if you have a problem, and they don't even know how to identify all the problems. So, like what's a precursor? What's a sign to this problem? Like, what's a sign of pelvic floor dysfunction? What's a sign that like your back pain is going to worsen over time? You know, all those predictive factors are not even part of their protocol in looking at a patient. So it is, like, we are living in a time where you have to self-educate yourself. You have to go above and beyond what's recommended by your provider. Typically, there's a lot of like incredible holistic providers, which I think you had a really amazing OB this time.
I did.
as well.
I really did.
But yeah,
Which
hopefully
made,
we'll
which
change
made such a
this.
difference. Yeah. Which, speaking of that, so can we talk a little bit about like how people can access the program? Because I did both. I did one-on-ones with you, and then I went through your program, and I think both are invaluable. But you are booked out till like kingdom come. So nobody can even get in. But the program is just gives access to so many more women. And I am going to be completely honest. Like, I think that it is way underpriced. I mean, I'm so glad it's the price it is so that people can access it. But like, my husband is also in healthcare, so I see what like prices are and everything. And I just think it's incredible that the price it is at for all of the education. And I can't recommend enough that that is your gift to yourself as you prepare for a pregnancy or you are pregnant. Please, like, seriously, like, if you have a baby shower, like, get a fund me to, like, that will give you such a better labor. And I know, people will save up and have a doula to have a better labor. You guys, I truly think that this is just as important because everything that I learned for labor, I taught my husband, and I would be like, write this down and print this in your mind, because in labor, I'm just focusing on relaxing and like creating that safe space. And I need you to remember these cues to be like, hey, remember, Angie told you to do this at this part of your labor. Angie told you to do this. And so he would like give me those cues so that I could just stay, calm and centered in that safe space. And I was like, you need to remember this. So I just think that it's so important. And then as you go through the program, you can take videos of your form and send it to Dr. Angie, and she will like let you know if you can do this better or whatever, because that's important. So let's talk a little bit like, how would they access this? Like, what does it kind of entail? I think people only ever think of pelvic floor therapy as I get referred by my OB, so I see if my insurance covers it, and then I go for like 6 visits because that's all my insurance covers. So I think it is a little scary. I'm going to come from the other side. I think it's a little scary to be like, oh, this is out of pocket. Like, why can't I go to my pelvic floor PT that is in insurance by my doctor? And I will just answer for you, because you won't see the difference in that. It makes such a big difference. Like, you guys, I went that traditional route in terms of my pelvic floor care. And I've heard it from so many women. They're like, well, I was just told to do Kegels, and I was told to like do, the belly breathing, when I would work out or not work out, and to get into a deep squat. And I'm like, okay, well, there's so much more you can do. So even though I think it's scary to be like, this isn't an insurance, this is out of pocket, it is so worth that investment. So that was really off topic. So let's jump into the program.
Okay. Yeah. Just a note. Yeah. Let's talk about the program. A note about pelvic floor PT is kind of like we just discussed. Our current Western insurance-based medical model does not allow the practitioners to get as deep into your case and be as holistic as they need to be when they're working for a corporation that accepts insurance.
Yeah.
Period. That used to be me. And that's why I got out of that, is because I was unable to make a difference for my patients in that model.
Yeah.
And then I was able, then when I went to, work for myself and not accept insurance, then I was able to, like, the world opened and I was able to provide this level of care that really changed. And then with experience and lots of patience, I was then able to create this protocol that now you can access online independently. So let's dive into that now. So this protocol has really 4 sections, and each section, each part of, the whole is just as important in the others. So it, if used individually, it's not going to produce as much of a result. Each of the pieces are really important, used in unison. So the first part is education. It's absolutely critical that you understand your anatomy and how your body works, why it does what it does, and how to prevent injury. You need to know like what happens, what causes injury, and if you're currently experiencing symptoms, why do I have these symptoms? How did I get them? That is key. Identifying the problem. Once you can identify the problem and like be aware of why it's there and where it came from, you're like halfway there to fixing it. It's as simple as that. You have to know what the problem is. Second section is the therapy technique section. So this is where I go into great detail about organ positioning, how to position your organs through posture, your daily posture, through breathing, how you breathe all day, and through an abdominal massage. I also go into great detail about how to make your pelvis and your spine and your abdomen more symmetrical to support centered organs through trigger point release and stretching. Then the third section is hypopressive training. And so this is the breath training that we've touched on quite a bit in this podcast today that creates this really incredible reflexive activation of your entire core as it lifts your organs, as it tightens and strengthens your internal fascia, as well as your external fascia. So internal fascia is the ligaments that support your uterus, the ligaments and fascial planes that connect your uterus to your bowel, to your bladder, to your spine, to your pelvic floor, to your diaphragm, all the way to your rib cage, all the way up to your head. So it works on all the fascial chains in the body that connects everything. And then it tones and strengthens your pelvic floor, your abdominal, and your spinal muscles in an incredibly, like, I'm always in awe about the visible changes I see, like, in a single session of working with somebody. And even when I'm not one-on-one with people, it's a patient who's currently doing the online program and we're not even doing one-on-one sessions. I love still engaging with the clients who are doing my online program. I really encourage them to email me and keep me posted on progress. So I often hear that just like after their first day of doing the breathing exercises or the mirror drills, they notice a visible change in their belly. And it's because we're working within the involuntary nervous system. So working in the voluntary nervous system, changes actually happen a little slower. But when you're in the involuntary nervous system and you're eliciting reflexes, things happen like incredibly quick because we're bypassing like the frontal like cortex of our brain. We're bypassing like the area where we get stuck in thought. And we're just like within our like kind of instinctive reflexive nature. So changes like happen really quickly there. So that's the hypopressive training, creates that organ lifting, reflexive core activation, fascial tightening. and decompression. It really opens up the spine and can be incredibly relieving for all sorts of spine conditions, tailbone pain, pubic bone pain. And then and then it's also really amazing for that stress regulation, like we talked about. I don't address that face on, head on or anything. That's not my specialty, but it's something that I consistently observe. And it's just such an amazing, beautiful thing that it is when you train breath work and you really focus on the subconscious nervous system. An incredible bonus of that is your ability to withstand all types of stress, just increases. So that's cool. Kind of like how when we improve the function of the core, your aesthetics improves. It's like this nice little bonus. We don't like enter the situation from that perspective, but it's like a cool bonus to observe.
Helps regulate the nervous system.
Yes, exactly. And then the final section is glute strengthening. So healthy glutes, the glutes are a very important part of your core. And the glutes are, responsible for stabilizing your pelvis and making sure that you have symmetrical pelvic and spinal alignment, which of course impacts pelvic floor function, organ position, breath patterns, all of it. So those are the 4 sections: education, therapy techniques, hypopressive training, and glute strengthening. So those are all instructed in like a specific order. So you just go through the program like video by video in the specific order, and you implement the entire protocol. There's also a calendar section which explains how to schedule all of the exercises in and how frequently and how often to do it. And what it really comes down to, if you execute the entire protocol, it comes down to 30 minutes a day, 5 days a week. And those 30 minutes can be broken up into like 5 or 10 minute increments to fit your day, which I actually highly recommend. I don't recommend just like doing everything at once in one little thing. It's kind of nice to just give yourself the flexibility and freedom to like have each day look slightly different, and just get them in like where you can. That's especially important for moms. So this protocol was created actually when Maya was I started it when Maya was 3 months old, when my whole world was shifting and I was like, whoa, I have like no time. So this was really created with like that in mind. And then there's a resources section with just all of my favorite therapy tools that can help kind of enhance things. And also, another note on the calendar section, 30 minutes a day, 5 days a week, broken up into whatever increments you want in each day. Now, life happens and we're like, oops, I didn't do it for 2 weeks, or oops, I just don't, whatever, for whatever reason, you don't have the time to get something in. That's okay. Even if you, decrease that to 10 minutes a day, 5 days a week, 30 minutes a day, 2 days a week. Like, even if that looks different for you and is less, you still are going to get amazing results. So that the calendar section, it's like not hard and fast. It's like these techniques are just, they're so powerful that even if you have a couple weeks where you decrease the time, or even if you choose to do a little bit less over a longer period of time, as long as you're, kind of consistently coming back to it, the changes can still like occur in a really big way.
Yeah. And is there like a separate pregnancy section, or is that in the hypopressive section?
Yes. So the hypopressive training section now includes a pregnancy section. So the modification during pregnancy is you just eliminate one part of the breath cycle, which is the breath hold. That's called apnea.
Mm-hmm.
And so now I have pregnancy specific instructions where you'll see me instructing a pregnant client, and you can follow along with pregnancy specific exercise flows. Now the protocol is the same during pregnancy. So it's the same. And, if you buy the program, you can reach out to me and ask me questions about, specific modifications for your case, and we can absolutely address that. But it's the same during pregnancy. There's just a slight modification during hypopressive training, and you can follow along with that now, specifically see a pregnant client doing it.
Which can be helpful, I think, because I remember the first time, this was before I went through your program. I was watching one of your videos on Instagram, which everybody should go watch your videos on Instagram. But you were instructing somebody on an apnea. And let me tell you, I had no idea what an apnea was. And I'm watching this exercise going, I can never make my ribs do that. And I just on my own was trying to practice this. And I'm telling Seb, I'm like, I think I'm going to pass out. I cannot do apnea this way. Watch her ribs. How does she even move them?
Right.
And it was just mind blowing for me to see that end result. Cause I know we see these videos on Instagram and we're like, oh my gosh, I can just follow that and that's going to solve it. Let me tell you, I tried. It didn't work. I had to go to in the program, it was the start with the mirror drill and then do the next exercise. And then I did apnea. I'm like, that's why it wasn't working before.
Okay. Yes. Yeah. Great point, Leah. Yep. Absolutely. It is, the preparatory exercises for apnea and hypopressive training are absolutely critical to your success in actually performing it correctly. So starting from the starting point, you have to kind of build a certain level of awareness in your breathing and your core and your posture to then be able to get into that hollow belly position. Yeah. And you learn all of that very, very step by step in the online program.
And it's very, very doable once you do that. Cause I have so many, ladies who will reach out and are like, I can't make my stomach look like that. And I'm like, yeah, neither could I. But if you start with step 1, you will get to step 10 eventually.
Yeah, absolutely. Exactly.
So important. So we're going to link your Instagram and we're going to link my core recovery program, which, we have a discount code for you guys. It's, I don't even know what it is. It's either Leah or Leah 10 or something along those lines.
Yeah.
Okay. Thank you. And you guys, I don't get kickback from this. I truly just, everybody needs to do this program. I just think if there's one, you should also test your minerals during pregnancy, but if you're going to do one physical gift to yourself, please let it be this. And you can do this if you're not pregnant. I think every woman should, but seeing the massive, massive, massive difference in my pregnancy, my labor, and my postpartum. I truly just think that, I don't know. I mean, if you aren't having troubles walking and sitting up and you're not in extreme, pain, it makes for a much better postpartum recovery.
Absolutely. Yeah.
So highly recommend. Thank you for listening to today's episode of Balancing Hormones Naturally. If you found this helpful, I would love for you to share it with a friend and post it on your stories and tag Balancing Hormones Naturally podcast so we can get this message out. You can find me on Instagram at Leah_BRUEG, and I would absolutely love to hear from you.